everyone here at the Smile Doctor. We're here today with Chris. Thank you for letting us share your video. And very exciting, so we're going to do some of the fillers and doing the lift. So can I ask you, Chris, what was it that inspired you to have a cosmetic treatment done?
Oh my gosh, well, I want to look my very best for my age and just look refreshed and youthful.
Very good. You've come to the right place. And one of our A+ students looking for extra credit. She does look great. Chris looks great. Do you mind if we share how young you are?
I'm 64, soon to be 65.
Amazing. Congratulations. And patients today, they don't want to wait for the advanced aging changes. So we're going to stay ahead of the game and be proactive. So today, we've already marked out, you see the little white marks, I'm going to use some Sculptra around the eyes, Bellafill around the mouth, define the jawline a little bit, cheek, and then temple. Any questions about our goals? Chris and I spoke a little bit before we started. Any questions I can answer for you, Chris?
No, you're in.
Very good. You're going to do great. I'm going to do a little cleanse on the skin. And Charlene is our camera person, and Claudia as well. They have everything set up perfectly. Thank you, everybody.
You're welcome.
It's such a great team. Makes it so much easier for me. Okay. So, for the physicians and students that are watching, I like to use the Hibba cleanse for cleansing on the skin. It's very rare that you get an infection for these types of injections, but of course we still do the cleansing and we'll do the lift as well. It is so remarkable that people are living so much longer, much healthier, looking better, smiling more. And Chris is a good smiler. She knows the power of smile. So I like to use the lidocaine, and I also like to use the buzzer. So you'll feel this little buzz, and then pinch on 3. 1, 2, 3, pinch. You feel small, medium, big pinch, not too bad?
Not too bad.
I'm not in a hurry. If you need a break, you let me know. 1, 2, 3, pinch. 1, 2, 3, pinch. It's very normal that we hollow around the eye, so we're just putting back 1, 2, 3, pinch what was already there. 1, 2, 3, pinch. Sorry, pinching. 1, 2, 3, pinch.
Okay, we have a couple of people asking about prices on the fillers.
Yes, so the pricing depends on how much you choose. So you can go to imagelift.com/pricing and put in your wish list and come up with a price based on what you're looking for. Or we can set up a consultation, buzz and pinch, 1, 2, 3, pinch, so that you can have a price about what you're a candidate for and what you're interested in, 1, 2, 3, pinch, because we don't want to mislead you by putting a price, 1, 2, 3, pinch, that doesn't apply to you. 1, 2, 3, pinch. So it's always better to get a little information to give you more accurate pricing. Pinch. So 813-463-9245, 1, 2, 3, pinch. Or message us or email. And we'll get you the information that you're looking for. So now, I like to start with the Sculptra. Now I use the safety cannula. You feel a little bit of a pinch here, not too bad?
Not too bad.
How about here, a little pinch?
No pinch.
And a little pinch over here?
Yes.
A little pinch. Perfect.
Will this be a Sculptra
So we're
procedure?
going to use some Sculptra and some of the Bellafill. How about here? Small, medium, big pinch? Not too bad?
Not too bad.
Chris is tough. We try and make it easier than going to the dentist's office.
That's very good.
We're in Tampa and the Villages, Florida. We're on a mission to stop bad plastic surgery and help our viewers do things the right way. I like to mix the Sculptra right before I inject it because it can settle a little bit. So I start in the cheek. It makes the cheek feel a little goofy. Let me turn your head this way. And numb. It feels a little numb, and that's normal, and that, of course, goes away. Pressure, pinch, pressure, pinch. Everything's looking good. You feel small, medium, big pinch there, not too bad?
Small.
What procedure is she having
Claudia,
done?
can you have an extra cannula available for me? Can you grab one like that for me, please? We're doing the Sculptra injection, and just have it available in case I need one, the orange, please. Very good. But don't open it just yet, look at things. And then we're also going to be doing the lift, image lift with laser lipolysis. I use the shiver technique to put a very fine amount of filler over a large area. Perfect. Doing okay?
I'm doing well, thank you.
You're tough. But you don't have to be tough. My wimpiest patients tell me they're like, it's fine, I did great. So, you sit up, consistent, and you see this in here, see the difference? And you make them like that. Thank you.
How long does Sculptra last?
Sculptra lasts about 2 to 4 years, maybe longer. It depends. Let me turn your head this way. Because we have variable aging. We go through growth spurts. We go through aging spurts. Pressure pinch. Stressful time, illness, weight gain, weight loss. People take care of themselves differently. Some people are more proactive than others. The more we take care of ourselves, the longer you're going to see the results last. Very good. I like to recommend 5-minute massage 5 times a day for 5 days. So everything right over there. That's perfect. Just what you need. I like that. Okay. That way, everything over the trip. So this one's all set. So you see, we save them there so I can track. And then here, once you mix them, you just mix them in. Thank you.
What procedure are we doing today?
So we're doing some of the facial filler with the Sculptra, and we're also doing some Bellafill, and we're going to be doing the lifting procedure for the neck and the jawline. Chris is our A+ student looking for extra credit, and that is okay to be proactive because with these procedures, we're going to guarantee, of course, that you look natural. It's not going to go too far. Chris already does not look her age at the age of 65 almost, 64, and always is better to stay ahead. You feel a big pinch, little pinch, not too bad there?
Not too bad. Just more pressure.
The more I inject, she'll feel more pressure and less pinching because that lidocaine starts to do its job. And I'm protecting with my finger and guiding and also massaging and tapping, and all of the above helps to get a nice, even result. So I see 1, 2, 3. Looks like I need to see 2 more. Can you go grab those other 2 Bellafill 22?
In the back, Dr. Rich.
They're right here? Okay, got it. Perfect. Very good. Yeah, thank you. You turn your head this way just a little bit. It's like tennis going side to side, back and forth.
Does this eliminate mouth creases?
So you can fill some of the creases around the mouth. I can never use the words gone, take away, get rid of. If you take something away 100%, it can look unnatural or extreme or severe. Very good. Can you move this way just a little bit? It's very normal that we hollow around the eye. You feel a little pressure pinch. This is advanced technique. I do surgery around the eyes all the time, so I feel very comfortable. And I've done over 20,000 syringe injections of filler. Get the hang of it after 20,000. You doing okay, Chris?
Thank you.
I always ask patients if they need a break, let me know, but it's very rare. Patients will usually say, no, that's fine, keep going. You turn your head this way. Even my patients that they're very needle phobic, they'll do very well with us. My wife is so afraid of needles, like when she gets her blood drawn, it's a very traumatic for her. So when she comes in to do her Botox and filler, of course I gotta take great care of her too. So we'll take great care of all of our patients. Everything's looking good, and then I like to recommend that 5-minute massage, 5 times a day for 5 days. I'll put just a little touch here in the temple, because it's the twist technique to advance and place the cannula where you want it. It's the shiver technique to put a very fine amount of filler over a large area. Then hydrodissection, when you inject a little bit of the filler under the skin and you massage, you are hydrodissecting. You're pushing that filler out to open up and improve access for future passes of the cannula. Pressure pinch, pressure pinch. Good, a little bit there. Everything's looking good.
Do you do threading?
Right, threading, yes, I've done that before, and you can certainly get great results with threading. The only challenge with threading is it only lasts about a year. So a lot of patients, they really want more of a result than what threading can deliver if it's only going to last a year or less. So that's where, threading's kind of like bubble gum. I think it's great and can be great for short term, but when patients want more long-term results, that's when they come to see me. Threading sounds great. It is certainly nice to have zero downtime. But more importantly, I think patients are interested in getting that result that's going to last them.
How much for one syringe?
So yeah, it depends on which filler you choose. We have Bellafill, and the team, they do have certain specials. If you buy one or get a bundle package, they have some specials. So give us a call, 813-463-9245, or you can go to imagelift.com/pricing and put together your wish list, and the pricing is there.
Instead of threading, what would you recommend?
So the answer is it depends on what is needed. That's a good question. The answer is, what are you looking for? What are you looking to achieve? If you like what you see when you pull back on your jawline with your hand, well, that's an indication that you may be a good candidate for a lift or tightening procedure like we're going to do today. There are the energy devices, ultrasound, ThermiTite, all of these things. Those things get modest results and do not get the same result as when you do little stitching with tiny incisions that are difficult to see. And everything I do is under local anesthesia. So you really need to understand your technology, and you don't want to waste money on doing something that's not going to be the right treatment for you. So tightening procedures, the ones that last the longest and look the best are lifting procedures, mini lift, image lift, all under local anesthesia, and not a traditional facelift. It's usually not necessary for what patients are looking for today. Very good. Thank you for your questions. Thank you for your comments. We like to keep in mind the ABCs of plastic surgery. When you know the ABCs, you're going to make your best decisions and get your best results. A stands for area. There's 4 basic areas that we address to improve the facial appearance. If we sag, we tighten. That's what we're doing today. If we lose volume, we fill. And we're doing fillers right now. Sun damage, wrinkles, and sunspots to the skin. You can always polish and repair the skin. The 4th area is better than everything else. That's our behavior. And Chris definitely knows the power of smiles. She's a great smiler. And none of our treatments look as good as when we smile. I can't outdo that.
After the injections, do they wear off?
The numbness wears off and it feels pretty normal. Sometimes you can feel a little achy after fillers, but usually not. The Bellafill is permanent. Sculptra lasts 2 to 4 years, and Sculptra is a superior collagen stimulator. That's why I like to use it around the eyes, because around the eye is the thinnest skin in the entire body. Everything's looking good.
Are you the doctor that does all the procedures?
Correct. I'm the doctor that does the procedures and treatments in our office. Caitlin does some of our injections and Botox and filler, but for the procedure today, it's going to be me and only me. And we have our assistants here that help me out, which I can't do without them. They do a great job as well.
Thank you, Dr. Rich.
Thank you, everybody. Thank you, Christine. Thank you, Ari. Thank you, Charlene, and thank you, Claudia.
You got it. Thank you. And thanks, Chris.
And thank you, Chris, for allowing us to share her video, her teaching video.
Mm-hmm.
So it's very normal that we hollow in our temples as we get older. So we're just putting back the volume that was already there. So it's very instructive if you get your photos from high school or in your 20s, and you'll see how the volume changes. You feel a little pinch there, not too bad?
No, just pressure.
Everything's looking good.
Do you take care credit?
That is correct. We do take care credit. Turn your head back this way a little bit.
Where
Very
can we
good.
find prices?
Yeah, you can find pricing at imagelift.com/pricing, or give us a call. We always we need to get a little bit of information from you to give you the correct pricing, because if you just put a price out there, it can be misleading if we don't know what you're looking for, what you're trying to achieve. This is very much artistry. So it's not a plastic surgery drive-through window. You really need to have an understanding of what is possible and what is right for you to do things the right way. People are getting into trouble with cosmetic procedures. That's why we're on a mission to get this information out there. People are not going to make their best choices until they really know their options. You doing okay, Chris?
I am, thank you.
Very good. Now make sure you're following, and thank you for sharing, because we will be doing a procedure next, her lifting procedure. So if you're following, you'll get a little alert. Turn your head this way a little bit.
Okay, Susan says, my jowls sag. Thanks, Mom. How does that work?
So if you like what you see when you pull, it's a good idea to have a consultation to figure out precisely what is the best treatment for you. Because it depends on your anatomy, it depends on your expectations, it depends on downtime. All of those things factor into what is the right treatment for you. So, and you will find it very instructive to have a consultation or come to one of our seminars. We have our waterfront inn seminars coming up tomorrow. Chris, did you get a chance to go through our book?
I did.
Was that helpful?
It was very informative.
Oh, good. Okay. You can download our book from Amazon. It hit the Wall Street Journal bestseller list. We guarantee we can make you look younger. We have all of our resources out there, and we're creating even more resources yet so that you can learn what's right for you and choose the best treatment.
Should I wait to lose more weight to have this done?
So the question is, should you lose more weight before having treatment done? I would ask you, how much weight are you planning on losing? So depending on how much weight you're planning on losing, some people, you can have the lift now. It inspires you to have, lose your future weight. Traditional teaching, they would say lose all your weight first and then do a lift. But I have many patients that are very happy doing their lift first, depending on how much weight they are attempting to lose. So again, we're back to consultation is the best bet, but you do not have to lose all of your weight before you're going to have the lift. That is not true with the types of procedures we perform. You turn your head this way just a little bit. Now in the corner of the mouth, I'm going to fill a little bit through there. And
I have the upside down frown.
say that again, Chris.
It's upside down.
The upside down. We're going to turn that up a little bit.
Yep.
So with the corners of the mouth, 1, 2, 3, pinch. Just putting volume back where it already was when we were younger. Not easy being human, but we have great options nowadays, way better than what we've had in the past. Very good.
Oh, Susan says, when I come in this month, will you sign my book?
Of course, bring your book. We're happy to sign it for you. Love to. I was just up in Salt Lake City and I did a training there for a good friend and colleague. What a wonderful team he has, and we talked to him about how we take care of our patients, and it was very well received. It's really an honor to be invited to some of the best facial plastic surgery practices in the country and in the world, and it's an honor to share what we do to take good care of our patients and continue to raise the standard. I like to put a little bit of filler in the nasolabial folds. I know some injectors don't like to do that because they feel it doesn't get much of a result, but you'll feel a little pinch here, 1, 2, 3, pinch. But we lose the height, pinch, of the premaxilla and the vertical maxillary buttress, so I'm just replacing that volume. It is important to pay attention to that because it really helps with the overall balance. Let me turn your head this way a little bit. Just a little bit, not too much. Just enough, not too much. Twist, twist, twist to advance to the correct position. Shiver technique for very small amounts of filler over a large area. Perfect. I like to mix a little extra lidocaine in with the filler to make it a little less viscous and a little more comfortable. How's Chris doing?
Chris is doing very well.
Very good. She's being such a great patient. We haven't had to give her any warnings or anything like that. I'm just kidding. We don't give warnings. We don't give warnings. We make people comfortable. We need to adjust the pillows, pillow under the knees, pillow under the back. All of those things we can accommodate to make sure that you feel good during your entire treatment. Some patients, they don't even remember any of it. Some fall asleep. Some, we have a nice conversation the whole way through. So it just depends.
I'm very, very, very relaxed.
I feel very relaxed too, but I didn't have any relaxing medicine. Very good. So I like to use a 27 gauge cannula. And sometimes if the cannula gets blocked, I can just clear that out, or I'll just replace the cannula. Use a different cannula. And it goes on standby. The cannulas have really revolutionized how we inject fillers. It's safer, less bleeding, better results. Very good. Thank you for watching. Thank you for sharing. We're in Tampa and in the Villages, Florida. So now I like to assess. We have you open up your eyes and look straight ahead like you're talking to someone. Make a big smile, a big smile. Now relax like best you can. I'm going to do just a little bit in the temple because that is an area that shows. And when you can fill that in correctly, let me direct your head all the way back. It's very, very powerful how that makes us look younger. You turn your head this way just a little bit.
Yeah, I see the pollen there. Like,
Not anymore. But that is a very normal sign of aging, and that is something that we can address in a way that looks natural. And family and friends, they don't figure it out unless you tell them what you did. Of course, the before and after pictures show a noticeable difference, but when patients see their pictures before and after we do a treatment, our vision will get better and our memory gets worse. Because when we do a treatment, our vision gets better, we notice things more that we never saw, we never paid attention to. The memory gets worse because we do forget what we used to look like once you see your new look with the fillers and the lifting, and you say, well, this is the way I always was, wasn't I? My Aunt Shirley did her lift and laser, and when she came on TV to demonstrate her results, after we did the segment, she looked at the monitor and saw her face, and she says, you know, I just don't remember having all those wrinkles like that before. Everything's looking good. Perfect. Little by little, if we need to come back another day and do more, it's better than going too far, but with what we're doing today, this is going to be a substantial difference that, again, looks very natural. So ABCs of plastic surgery, there's 4 areas. If we sag, we tighten. If we lose volume, we fill. Sun damage, wrinkles, and sunspots to the skin. We can polish and repair the skin. The 4th area is better than everything else, and that's our behavior. Nothing looks as good as Mother Nature's free facelift. And turn your head this way just a little bit. The B for boundaries, there's 4 rules for good plastic surgery. Safety is always first. You must look natural. Let's prevent future aging changes, and let's get as much improvement as possible. And turn your head this way. We can't make things perfect. We're not God. We do the best we can, and if you need to come back another day, that's better than going too far. C stands for combination treatment. We get our best results when we combine. So we are done with the filler. I want you to open your eyes for me. So can you see how it builds these areas? What temples? Now it's a little swollen, so as we say, you don't want to taste the chocolate cake before it's done baking. Are you happy with what you see?
Yes.
Okay, so what we're going to do now, we're all done, and we're going to get started with the, let's take a look. Here's her pictures from before. So Chris looks amazing. Does not look her age, 64 years young, right? And soon to be 65. And then when you look here and compare, you see the fullness across through these areas. So very proud of your results. Congratulations. And we'll be starting with the lift in just a moment. Thank you for watching. We'll see you in the next video. I'm Dr. Rich Castellano, the Smile Doctor here at ImageLab. Okay. Let me start this over.